Hi everyone, Danielle Thorpe from Pendle Council in the policy and programme team with Jill Dixon, who isn't with us today. She's got a day off.
Okay, thanks, Danielle. Vic, I think you know who Vic is, don't you, Sonia?
No, we
Just
should.
just in case others don't, Vic, do you want to introduce yourself?
Yeah, I'm Vic, Victoria McCoy. I'm Healthy Lifestyles Lead for Pendle Leisure Trust.
Thanks, Vic. Kim?
Complex Case Manager for Pendle Integrated Neighbourhood Team.
Thank you. Pam?
Social prescriber for Pendle East PCN.
It's like I'm talking to my mum on WhatsApp. I can only see that part of your face, Pam.
I was oh, hang on. How's that?
Thank you. I can see your beautiful face now. Thank you, Pam.
You're welcome.
Fiona, do you want to just introduce yourself?
Hi, yeah, I'm Fiona. I work at the Up and Active team for Pendle Leisure Trust, and Vic's my manager.
Thank you. Danielle?
Summit Team P9.
I'm sorry we didn't quite catch that.
I'm team leader for Adult Summit Team P9.
All right, thank you very much. Rashta?
Hi, Sonia. I work in the ICB. I'm part of the communications and engagement team.
Fab, thank you. And I'm not sure whether that's Becky or not. Becky, is that you?
Yeah, it is me,
Yeah.
yeah.
Yeah, okay.
So I'm Becky, I work for Pendle Rosendale CVS for adult social care.
Thank you very much, Becca. Okay, without further ado, Sanya, do you want to introduce yourself and then it's over to you?
Yeah, so I'm Sanya. I am the Community Engagement Coordinator for Women Heart Welfare Foundation, but I'm also the Physical Activities Network Coordinator for Together an Active Future. So part of my role, me and Madge have been developing a toolkit showcasing the health and wellbeing community groups across Pendle. So I'm just going to share the screen. So just want to make sure. So you might need to accept it, Tracer. Wait till it comes up. So yeah, so this is the toolkit that me and Madge have been developing. So it showcases community groups across Pendle. So there's two reasons for developing this toolkit, and one of it is it's a resource for healthcare professionals, care professionals, and the third sector groups to utilize it as a resort to help them with finding out what's out there in Pendle. And it's also used to identify any gaps in service provision. So I'm just going to kind of go over the toolkit. And so any questions, anything, feel free to ask. I just want to highlight that this toolkit is evolving and it's ever changing because, as we know, health and wellbeing groups always changing what they're offering and what service provisions they cover. So from when we started this toolkit, so much probably has changed. So just bear that in mind whilst I go through it. So this is the tab. Can everyone see it? Just see, yeah. So what we're looking at is the name of the health and wellbeing group, what service provision is covered, the eligibility criteria and the age requirement, the type of activity, the area that they covered, the cost, and the name and contact details. So this is what we've been collating throughout each tab, and some of this information was collated through from the Pendle Health Summit back in June, and some of it through our roles. So each of the tabs, I'll just scroll down. So they've all been grouped into each service provision. So if we look at the top, so these are all the groups that cover all service provisions. And then if you go down, these are the groups that cover older people, carers, adults, etc. So there's quite a lot when you look at the groups that cover across Pendle. So there's quite a lot that you can see in this tab. And then I just go over to Bradley. So obviously Nelson consists of different wards, so we broke it down to each ward to showcase, you know, what each ward, what the health and wellbeing groups are out there. So this is Bradley, and I think many of us know there's quite a lot going on in Bradley at the moment. I think because of the highest health inequality in Bradley. So there's been quite a bit of funding in Bradley as well, through like yourself, CVS, and various others. So as you can see, we've got quite a bit going on in terms of, you know, health and wellbeing groups and you know, the service provision that there's out there. Like we've got adults, we've got services that cover all service provisions. And then you've got Marsden, Southfield and Wolverton. Now, I found when I was collating data for these 3 wards, I had to put it in one tab because there wasn't much going on in these 3 wards. And as you can see, there's not much data there. There probably might be more going on, but from what I collated, there wasn't much out there. So in terms of identifying, like for community groups, there are provisions for them to put on things in these areas. Like they've got the community asset of the Unity Hall, and the Nelson Town Council have ownership of Unity Hall, and they have said that, you know, community groups to come and utilise Unity Hall to put on health and wellbeing provision. So maybe that's something, you know, some community groups can look at. And then we've got Whitefield. Whitefield ward has quite a bit going on. And in terms of like all service provision, children and young people and ethnic minority. Now, when I look at Bradley, Marsden, Southfield and Wolverton and Whitefield, one of the biggest gaps that I found was provisions for older people and people with disabilities. And I think that's might be an area that, you know, where community groups can come in and utilize maybe putting some stuff on for older people and for people with disability. And with Marsden, Southfield and Wolverton, one of the gaps that I've also found was provisions for children and young people. I felt that there wasn't much there out for them in that area. There weren't that many groups for children and young people. So that might be another area that another gap that we can, you know, work together, community groups can come together and maybe put some provisions in place. So yeah, this is Whitefield, like I said, so same gaps as the other areas. And then you've got Briarfield, and Briarfield does have quite a bit more going on, maybe because the area is quite bigger than the others. So as you can see, I'm just doing like a really overview. I will send this out at the end so everyone can take a look at it. So this is Briarfield, this is Barrowford. And then I'm just going to go into the areas that Madge has been looking at. Madge has been looking at the Pendle East areas. So this is Fullridge. This is what the data he's collated for Fullridge. There's not much going on, but however, the area demographic is quite small. So however, that doesn't say that we can't put more health and wellbeing groups on, but it just, I think, like the other wards that I have, like the wards that I've been looking at, Madge said like provisions for older people and provisions for people with disability, there was a lack of it in like Fullridge. Barnoldswick has quite a lot, well, not a lot, but it has quite a bit going on. As you can see, like the library, Eco Barnoldswick, Make a Difference. There's quite a few things going on here, but yet again, provisions for older people and people with disability. He felt there was a lack of it in Barnoldswick. So that's another area where maybe people, community groups can come into. And then you got Corn, Waterside, and they have quite a bit going on. And I, even from my own, when I was looking at data, like collating the data, I found that Corn has quite a lot going on. However, they still lack provision in for people with, like, for older people and for people with disability. And then you've got Eby, and then you've got Trawden, which I just show there. And obviously, like Trodden is a small area, and so there might not be that much. Looks like there might not be much going on. However, the community group is fantastic, and they do all sorts in there for a range of age groups, and they're really quite close knit community as well. And then we also looked at the green spaces and blue spaces across Pendle. And then we looked at like the community assets across Pendle. And then the final tab is like the key peoples that we've identified from across Pendle that might, people can, get in contact with. So this is basically an overview of the toolkit. Is like I said, it's constantly changing, it's constantly evolving. There's always new groups out there. So if there's anything missing, please do let us know. I think the next steps for us is to look at each area demographic and how it correlates with the prevalence of long-term health conditions. But yeah, thank you. Any questions?
Has anyone got any questions for Sanya?
I don't have a question, but I think that's really good, and it's good that it's evolving more, and it's like social subscribers as well. It's gonna help us a lot as well.
Yeah, and I've already sent it out to some social prescribe. I don't know if I've sent it out to yourself, but quite a few like Amy, Umel, and quite a few, and like the feedback's been great. And they actually utilizing it. So yeah, no, it has been quite helpful for the social prescribers.
Yeah, I should think we'll use it a lot. Will you be sending it out to everybody on this meeting then, so that we'll get it, or shall I put my email address in?
Just put your email just in case. Is that all right?
Thank you, Sanya. Yeah.
All of Sanya, if you can send it to us, if you send it to me or Lorna, we'll make sure that all the people at Pendle get it. I think also your observations would be useful as well, Sanya. Okay. Where you've said there's a lack of provision for older people, people with disability. I think that'd be useful for people as well, because I know for sure when we're working with community groups and the funding streams that we're working with, we can direct people to that. And say, there's a lack of this, that, and the other in this particular area. So, yeah, like Danielle says, there's a lot of work there. So well done to you both. It weren't easy because I saw all that, and I saw the first efforts and how you've worked it out from there. Who knows? You've worked your magic, Sanya.
Thank you.
Can I just ask, where will people find it though? I know you're sending it out.
I'll let Rick come, and I think it's going to go up in the Pendle Leisure Trust website. Is that right, Rick?
So yeah, well, we have got the startings of this on Pendle Leisure Trust website. It was when we did the event with the PCN, anyone that might have been involved with that in summer, we were looking at this as a starting point for a toolkit, as Sanya mentioned, and that was the original starting point. So we can look into what this looks like being hosted on Pendle Leisure Trust website, because it has evolved since then. But I know we've had some conversations with Tracy and other people as part of the Network for Change group around where should it sit though, really, where should it end up. And it is almost, it is as it is at the minute. We can maybe host it on Pendle Leisure Trust website as it is. But I think for us, it's twofold. It's looking at what the next stage looks like and a little bit deeper into that next stage around, like Sanya's just mentioned, Fulridge. It's a small population. There's only a little bit going on, but the demographic says it's older people, yet there's nothing going on for older people. So where do we look that mapping across into what could potentially services and organisations support with as far as providing sort of, support around specifics in reducing maybe frailty or, looking at strength and balance sessions and things like that. So I think there is 2 points to it. And am I right in thinking, Tracy, that we're going to have another meeting that might then explore this a little bit more?
Yeah, in the November meeting, we've got one guest speaker, if my memory serves. We've got one guest speaker, but we've also got Sanya and Mad coming along. we're face to face at that meeting, and there's generally more of us at that meeting. So what we're going to do, we'll look into it in a little bit more depth and ask organisations, what are you going to do to fill these gaps? You know, there are gaps. So by then, Sanya and Madge will have a better idea of where the gaps are, and what are you going to do to fill these gaps? If you can you help to fill these gaps, and what can you do to help fill these gaps? So yeah, if Sanya and Madge look at that demographic a little bit more, you know, if there's an area that's full of older people, but there's loads of children's stuff going on, you know, what's the point? But equally, if there's nothing going on for older people, then there needs to be some provision put in place there, or asked. You know, residents need asking. They might not want anything. They might be quite happy. You know, because not everybody does. But we do know that there's a high prevalence of loneliness, isolation, etc., particularly in rural areas like Folridge, Barlick, and Earby. So yeah, but I'm sure, you know, we can all work together and help people as much as we can.
Can I just ask, whose responsibility is it then, Tracy? Because groups notoriously disappear, don't they? So they're on a spreadsheet, or
we don't have anybody that it's. Are you offering, Kim?
No, not at all. No.
No, I've always been. I mean, if you've been at any meetings with me, when a director is mentioned, you'll see me head explode, because it's kind of it's impossible, absolutely impossible.
I know it's a few years ago, and we were in talks with Pendle Leisure then, and that was going to be hosted on the website. But it was that any groups that were on, they were going to be sent an alert somehow that in 6 months, you know, and if it wasn't still there, it would be taken off if nobody responded. Because that's the issue, isn't it? You think groups are there, and then when you try and find them, they've disappeared.
I think the only way to keep on top of some groups, I'm not saying all groups, but some groups, is to go through us, because invariably we have lists and lists of, and we have volunteers that go through those lists every 12 months or so, that make sure that those groups are still alive and kicking.
You just volunteered yourself, Tracy.
No, we can't do it. I'm not prepared to do a directory. It's just too hard. But what we can do is send out the funded projects, so we know that those projects are definitely happening. They're definitely happening this year. They're definitely happening at these venues or whatever. We can send that out to all of people at Pendle. But social prescribers and social connectors all have access to that anyway. So, but it wouldn't be. I wouldn't want to start sending that out to public, because some of the contact details are personal emails, because they're small groups. So we can't start sending those out. There's a whole host of hurdles, Kim. Whole host of them. So yeah, it's not just as easy as going, I know, we'll do a direct. I mean, they're all doing it at the moment. UCLan are doing it. I think somewhere in the hospital they're trying to do it. Well, good luck to them if they do it. And I know there's the what's that app called? I can't remember what that app's called. Not Data Lake. The one that Simon Dickinson's working on. That'll be available for people who work in health. That'll have a directory, but they are mostly public and statutory services, because they're static mostly. You can't do the community groups. You've just got to be out there and in the communities to know what's going on. I think it's impossible to do otherwise. Please disagree with me, anybody. If you know, feel free to disagree with me. Has anyone else got anything that they'd like to? Yeah.
Just second what everybody else is saying, it's a really fantastic tool, and this is something that the government has encouraged for more neighbourhood networks, more voluntary organisations to work with the NHS in the future. So there's more community care, so moving away from hospitals into the community. And this is something that we need when we go out and engage with different organisations. So it's really useful. Thank you.
Yeah. There's always a lot of talk in the Rashter about working with more, you know, NHS and other statutory services working more often with voluntary community and faith sector, which is really good. You know, it's a positive move. However, it can be quite difficult for the voluntary and community and faith sector to fit with the NHS expectations, not of service delivery, but of meetings, reporting, that kind of thing. That can be quite difficult.
And there is more and more requirement to work with different types of groups as well. So like the vulnerable, people with disabilities, the elderly, and it's knowing where to go to when they say, right, in Burnley, we want to contact these groups. So this is so useful. We can just look at the spreadsheet and think, oh, this is where we need to go. This is who we need to contact.
Yeah, the other thing is like I mentioned earlier, get in touch with your social prescribing team in whatever area you're in, and they should be able to point you in the direction. I know certainly here at CVS we could point you in the direction of all different kinds of groups, Rashta, that are up and running, if you wanted to. But yeah, that information of funded projects, the ones that are running now and will be running for, you know, the next 12 months, we can send that out to people at Pendle. In fact, I think I started sending it out at one time. I think that might have dropped off a bit, but I'll get that sent out again. So everybody's got, there won't necessarily be contact details on there because of the personal nature of some of the groups, because there might be just a small knit and natter group and it might be one lady that's running it and it's her personal email address. So I don't want to go down that route of giving out personal email addresses. But if you wanted to get in touch with them, we could facilitate that. So is there anything else anybody would like to add to what we've all already just said? My words won't come out today. I don't know what's to do with me. Sorry. Sanya, are you okay with that?
Yeah, thank you everyone, and thank you everyone for your feedback. Hopefully for the next one, because on the face-to-face, we'll be going into a bit more. So I'll take the feedback on board, and yeah, we'll bring it to the next meeting.
Great stuff. Thanks, Sanya. Thanks, Vic, as well. Thank you very much. And please thank Madge, even though he's scarving. Make him work hard at next meeting, Sanya.
He can present the next one.
Well, let him do it next time. You sit back and put your feet up. So moving on, we'll move on to the Pendle Health and Wellbeing Partnership update. Danielle, have you got anything from Jill that you want to? I'm not saying you have to, but has Jill give you anything?
She has, yes.
Okay, thought you might.
Yeah. Yeah, she just wanted me to update on a task group that's, I'm assuming it's a new task group that's been put together. It consists of NHS Property Services, the PCNs, Pendle Leisure Trust, Lancashire County Council and the council. I think it's called the Pendle Health Infrastructure and Service Integration Group, which is a bit of a mouthful. And the group is to look at how we can better utilise our public estates, so our buildings basically across Pendle, and how we can enable sort of better integrated services. So that's what the group are tasked with. That's all I've got from Jill, but if anyone does have any questions or wants any further information about that, she's just said you can drop her an email, so I can pass Jill's email on if anybody wants that. And that's it from me, Tracy.
Thanks, Danielle. Yeah, well, you know, we all know that, you know, yard spinners in particular, there's a whole floor there that's not being used. There's various other buildings as well that probably could be brought into use.
Yeah.
And it's something to do with who owns it, who leases it. It's a right complicated mess, I think, isn't it? I don't envy anybody.
Yeah.
Yeah, I don't envy anybody that's trying to sort that out. But yeah, so anybody who wants to email Jill, if you want to just pop Jill's email in the group chat.
Yeah.
And Jill's email is also on the updated members list that you get every month as well. So if you're interested in that, please do drop Jill a line. Okay, so you okay with that, Danielle? Have you got anything else you want to?
No, that's it from me.
Fab, thank you. Thanks, Danielle. So just a small update on the running saga that is the Lancashire County Council Adult Social Connections project. We have got a little bit further, folks. Christine, our Chief Exec, has now had a meeting with Lancashire County Council Adult Social Care and put the council's proposals forward. So we will be employing a social connector who will work with people with hoarding issues, but only to the point of increasing the confidence and encouraging them to engage in any services there are out there. This is not a whole hoarding, this is it, we're going to sort it out. It's not. So Kim, please rest assured, we know that that's not going to happen. All it is just, it's an adult social connector who will work with people that have hoarding, that have any issues, but particularly with hoarding issues, because we know it's a massive issue. And I know they're probably going to be inundated at first, but we'll see how it goes, and we'll get some advice from adult social care.
So Tracy, do we know what the role will actually be?
It's a social connector. That's the role.
Right. Zip it.
No. Kim, we've had that conversation. I passed on the information that you and Catherine gave to me.
Yeah.
The funding's just not there.
No, I just wondered what, like, we've just got a lady back, for example, that we had 5 years ago. She went on to social care. She went into residential care. We went to help a fire service social worker. She said, to declutter a property. We got funding from Transforming Lives then, and then she just stopped us halfway through, blocked everybody. She's now come back, but it's like I said before, they need to build up that trust with somebody, like a buddy. So that's what I was just wondering, how long will they work with somebody for, because it's like setting them small goals. I mean, it took years to sort this lady out, but is it 12 weeks? And
no, it's not 12 weeks.
So that's my only issue. I don't know where.
There's no time limit on either the link workers or the social connectors on how long they can work with somebody.
Yeah.
They can work with somebody as long as that person needs it for whatever reason. Yeah. So, and it's the same will apply. So we know that, we also know that we're going to have to work really hard to gather the evidence to make sure that Lancashire County Council know that it will need funding again. That it can't stop at the end of March. It will need funding again after that. But we need to start it to gather the evidence, and it's just taken so bloody long to get to this stage. It's not even now, it's not been confirmed by Lancashire County Council's adult social care that we can do this. It's just
so there's nobody in post or anything yet. No.
We have somebody. I've got a lady dangling at the moment that we interviewed for another couple of roles the other week, and she just stood out, and she's willing to hang on until November. So I've got her there, and she would be really good.
Well, like we said, it could be a really good role, but it needs a team. It can't be a lone person, and
no, we are a team.
Yeah, no, do you know what I mean? That's specifically for that. It's massive. It's not.
It is huge. We've said this, Kim, but the funding just isn't there. So we've got to start with what we can get. So we can get this. So let's start with this, and let's see what we can do with it. And then if we can gather the evidence that we need more around these people, then let's tell them that we need more. But we need evidence for that. We can't just say, well, we need evidence. We need some more people. Or we need some more services, or we need a psychologist, or X, Y, and Z, because they just won't give it us unless we've got the evidence. And let's face it, statutory services, they're having the funding cut left, right, and centre. So, the odds of getting it are like 0 to 0 at the moment. So, but we'll take what we've got. So let's think positively, and, we'll get this person working with whoever she needs to work with to build that trust and build that confidence in services again. And perhaps, as part of the befriending, because we've also put in a proposal for telephone befriending that is we've got a pilot running at the moment, which is going great guns. So that could be part of that as well. So it might not just be the trust and confidence in that adult social care social connector. It might be that we ask if this person would like somebody to ring them a couple of times a week and have a chat and build confidence that way as well. So they'll have quite a lot of contact with services that aren't seen as official, if you see what I mean.
Yeah.
So that might It's not going to work for everybody. We know it's not a one size fits all. It won't be. It never is. You know, Pam will tell you that. Becky will tell you that. You know, working in with people just won't fit in that box. And it'd be so much easier for public services if they would, but they won't. So I think just working with what we've got, let's take what we've got and let's try and run with it if we can and gather as much evidence as we can. So yeah, the befriending project, we are going to, like I said, we've started a pilot at the moment that's just running with a couple of volunteers at the moment, but we are going to be recruiting more volunteers, and we are going to be working with the colleges. So you know, anybody that's doing social care, early years even, you know, what are they called, public services, anything like that that's dealing with the public. And you know, we're going to try and encourage some volunteering from young people, and it'll all be done from it'll all be safeguarded, it'll all be, you know, nobody will have anybody's telephone number or anything like that. So it will all be within CVS, and we've got a social connector that's looking after that project at the moment, and she's loving it. You know, the feedback that we're getting from clients is just amazing, and the aim being to increase their trust and confidence, increase their confidence to the point where they feel empowered enough to kind of get involved, if they can, with community activities. So it's not about being a befriender forever and a day. It's about, you know, let's build your trust. And how do you feel about meeting me for a coffee, or you know, going to this community activity? So just taking a little bit of time to do that with people. Is there any issues that people, you know, is there any standout themes for anybody? You know, people who are coming to you for support, what are they presenting with? Is there anything new, or is it all the same stuff? Please talk to me.
Tracy, I don't know if it's new, but I think obviously it's probably been looked at. Is the food poverty. Like past couple of weeks, of course, part of my role, I work for a charity. I've been giving out supermarket vouchers for people, because they don't know who to access, or they don't qualify for a service. For example, I had a silent sick lady, and she doesn't get any benefits. However, I did refer her to that Pendle neighbourhood. Is it the neighbourhood team? New neighbours, that's it. So they've helped her, but is there's a delay? She needs it urgently. Who do I refer her to? Who do I access? You know, where can she get that supermarket voucher from? Like if she needs it urgently, and there's quite a few cases like that. The first thing I do is put a referral in for social prescribers, and they come and help. And then they refer her to agencies, and then we've got like the wellbeing Pendle, you know, the family hub team, the wellbeing services. They help, but there's a bit of a delay for them coming out to help, because obviously they got the waiting list, or the referrals taking time to be processed. So like for me, who works in the community, what else is out there that, you know, can help people urgently, like in an emergency, if they need like a supermarket voucher, or they need some food vouchers?
It might not be vouchers, but I know Pendle Food for All will give an emergency. They'll give an emergency bag of food. We have emergency provision as well, Sanya.
Okay.
If you know, you could pick it up from us. We're obviously it's not in Nelson, it's in Burnley, but we cover Nelson as well, and Pendle.
Hold open door as well for crisis.
Yeah, Cone Open Door.
Yeah, there's loads of places across Pendle, isn't there? It depends whereabouts people are based. Colne Citadel, Open Door, the churches, St John's, in Nelson, and St Bart's in Colne. That's Colne, isn't it? I was just going to say, we've been working on updating all our food information on our website. I don't think the website's quite caught up yet, but Leanne, our community engagement officer, has done a good piece of work that's got all the food help available. So I can send that to you, Sanya.
Yeah, that'd be great. I think it's more so, I know there's quite a lot out there. It's just that the lady who I was helping, she doesn't have no transport. So she lives in Nelson. She lives in the Bradley ward, so she won't be able to access Corn because she doesn't have no transport, and then she doesn't have enough. She wants to save that money to buy food, and she's things like that. So transport is a bit of a barrier as well. But do send me that list. Because whenever I come across people, because I feel like I'm coming across a lot of people like that, that are requiring help with just even getting the basics.
Yeah, well, you just put your email address in the chat and I'll send you that over.
Some of the masks help out as well, don't they, in Nelson?
Yeah, I've just put that in the chat. The Nelson Community Mosque does that, and they also do warm food as well, Sanya.
Yeah, I have referred her to them quite a few, but I think it was more so like she kind of needed it there and then.
Yeah, they do supply food as well, and like Tracy and other people have said, Pendle Food for All, they're really good. Is that the one that's based in the zone?
Yeah.
Yeah, they are quite good. I've been there as well to engage with people, and they are good.
Danielle, would you send that list to me as well, and then we can get it out to all of the members?
Yeah, of course I will. I'm just going to check with Leanne and make sure that I'm not sending anything out that she's not finished, because it is Leanne's. But yeah, I've got a few people asking, so yeah, we can share it with everybody.
Yeah, Fab. Thank you. Thank you, Sanya. Is there anything else that people are seeing a lot of? No, everything's wonderful in Pendle. Great. Great, lovely. Okay, so information sharing. So I'm just going to go around the screen. If you've nothing to say, that's fine. Just say I've nothing to say, Trace, and I'll move on. But this is the chance to share any information, ask for help or resources, and we can put the power of people of Pendle to work. So I'm just going to go around my screen. I'm going to pick on you again, Danielle, because you're first on my screen.
Yeah, no, I don't. I'm just trying to think. I don't think I do have anything to update on. The only thing maybe of note is that we're working on the winter holiday activities and food programme. So I'm sure most people probably know, but over the Easter, summer and winter holidays, we offer paid for places in different venues, sort of a childcare kind of situation, but there's enriching activities provided, physical activities, the kids get a hot meal, and it's for mainly free school meal pupils, so parents get vouchers from their school if they're entitled to that. So we, myself and Sam Cook from Pendle Leisure Trust, are working on that winter offer now, so I'll be able to tell you more about that when it's ready.
Fab, thanks Danielle. Thank you very much. Vic, have you got anything you want to tell us about?
So we have got a spinning memories session coming up, a one-off session. We'll be doing a couple of sessions, sort of trialing them, but we've got a session for people with suffering from difficulties with memory, feeling socially isolated, and we're running a session at the Muni on Thursday, the 13th of November. I can share it, or I can share it through you, Tracy, to get it shared out. But basically, anyone that you think might sort of gain from just attending a session with music and movement, playing vinyls, just to get out, that might not have got out for a while, that might be supporting someone, a carer. If what we do ask is if people feel they need support, then a carer must attend to support. But yeah, Thursday the 13th from 1 till 3 at the Muni. You can just turn up, or you can contact James Smith, obviously, social prescriber that's coordinating this, but I can share it through. Yeah.
And if anybody knows of any groups that are musical or have any, music kind of music therapy or anything like that, can they get in touch with Vic?
Yeah, thanks for that.
Well, we're racking our brains, weren't we?
Yeah. I think, if anyone knows for that, if the group of people that are trying to sort of offer connections and make sure that session is quite connected, for the people attending, like tactile, sort of visual, interactive. We're trying to develop this. We've done a couple, and we're trying to look at developing it to a point where next year we're looking to how we can maybe fund this and what it might look like, because it's something I think Pendle Leisure just want to be able to create as an offer, as a starting point for people suffering from or supporting someone with dementia. Stage door in Corn. Yeah.
There you go.
Brill.
Danielle putting
Thank
stuff.
you.
Sometimes all you need to do is ask, Vic.
Yeah. Thank you.
Kim, you're next on my screen. Sorry, did I wake you up then?
Yeah. I just thinking, Vic, you know, for that, could you approach schools just to see if children had come in? Because older folk like children,
do,
don't
don't
they? And
they?
they
Yeah, they
usually,
do.
you know, with the voices and that.
Yeah,
and
yeah.
Kids would talk, go around
That's
talking, don't
That's
they?
a good
Just,
idea, that, Kim. Yeah, yeah. They do, don't there's something in that, isn't there, with
Yeah.
children, I think. And yeah. Thank you.
No, I've not got anything, only really Dementia Positive Pendle's Christmas party's coming up on 2nd of December even. So we'll send you a poster.
Yeah.
But if anybody's interested, it is a really good do. That's at Colne British Legion.
Fab. Thank you very much. What is there a theme this year, Kim?
Just Christmas, but we'll be dressed up. So, and there's Dodgers are on again. It's like a well-established routine now. Everybody just comes in, gets down, sings along, has the lunch. It's a good do.
Excellent. Thanks, Kim. Pam.
No, I've nothing to say really. We have got Val doing yoga down at Hodge House on Wednesdays now. I think that's 11 till 12. And also the croquet near there will start up again, I think in March, because they've had some more funding, so that's going on again, which obviously you'll know. So yeah, it's about all really from me at the moment.
Fab. Thanks, Pam. Sanya, have you got anything you want to tell everybody about?
Yeah, so this Friday we're doing another community health and wellbeing event. This time we're doing in collaboration with Goshia Mosque. So that's the mosque that's across Morrison's. That's the best way to describe it, so everyone knows. So they want to help improve health and wellbeing in Pendle. So they said, Sanya, do this health event like you did last time, and you know, let's get all the services together and, you know, raise awareness of what's going on in Pendle, what services are out there for them to access. So yeah, that's this Friday. It's open to all. It's split in sessions. So we've got the women's session in the morning, we've got the men's session in the afternoon. Yeah, so just share the poster. I'll send it out to you, Tracer, so you can send it out. And secondly, I'm in the process of setting up a kindness kitchen. So it's a soup kitchen. It's going to be over the winter period, and it's for those who are vulnerable, homeless, and those low-income families. And that's going to be hosting it at Hodge House, because there's nothing at that area in terms of you know, like helping with food poverty, etc. So yeah, so I will send out, once everything's been finalized, I will send out more information about that, because I do want, we're gonna have a Meals on Wheels service for those that can't make it to the centre. So I do want like social prescribers or people that do like come in contact with people to make referrals. So I will send out, once everything's finalized, I'll send out that information to you, Tracer, so then you can forward that on to others.
Fab. Thank you, Sanya. Thank you very much. Rashta, have you got anything you want to tell everybody about?
No, nothing from me, Tracy. Thank you.
Fab. Thanks, Rashta. Daniel, have you got anything?
Nothing from me, thanks.
Brill. Thank you, Daniel. Becca, have you got anything you want to?
No, I don't think so. I think everything's been covered. I'm just soaking in everybody else's information, really. Thank you.
Good stuff. So CVS will be holding their long-awaited conference on the I want to say 26th of November. Is that right, Vic? Because I know 24th, 26th. It's either the 24th or the 26th of November. It's a Wednesday. Have you got a
26th?
Thank you very much. Yeah, it's a long-awaited conference. It will be in Burnley this year. I think it was in Colne last year. It's in Burnley this year. It's at the town hall, and the title of this year's conference will be Who. So it's Who this year. I'm not going to give too much away. There will be plenty of activities. There's food, plenty of food, and it'll be It'll be fun. It'll be a fun-packed day. So if you can come along, please do come along. It's an opportunity for networking with others, speaking to others, and finding out lots and lots of information. They've always been really useful and well attended in the past. So we hold these every 2 years. Our AGM will be immediately before, but we don't want to put you through that torture. So if you don't want to come to the AGM, that's absolutely fine. You can just come to the conference, and vice versa. You know, if you're very strange and you just like AGMs, please do come along to our AGM. But the invitation's out there, so please do book yourselves a place. We are asking, because it is very limited space, that you book quickly because places are going quickly, and there is only one person from each organisation allowed. I know that's going to give people nervous breakdowns all over the place because people do like to travel in pairs. However, we are a friendly bunch and we will assign you a buddy if you feel a bit nervous about coming on your own. So so please do book on that. It's our 90th anniversary year, so there's going to be lots and lots about our history. We are thinking, just to let you into a bit of a secret, and nobody else knows this, we haven't even had the okay from the chief exec yet, but I'm going to tell you anyway. We are producing a newspaper that will have all of the articles in that our Tom, our wonderful comms chap, has put together over the last few months, charting the history of CVS over 90 years. So that'll be quite nice that everybody's going to get a copy of that. So that'll be quite good. So yes, I'm sure there's lots more that I should be telling you, but you know what? It's Monday afternoon and we are 10 minutes early. So I think we all deserve a 10-minute break. So why not? So I am gifting you 10 minutes to spend as you please. Nobody knows that you're out of this meeting. I won't tell anybody. Go and skive off somewhere. Go and do something nice for yourselves for 10 minutes. And I'll see you next month. So thank you very much. Don't forget to put yourselves on our conference, and please do come along next month to People of Pendle, because we are going to, I might even do a video again, you know, of me swizzing around.
Yes.
Be there or be square. For people to come along to the People of Pendle next time, because we are going to be doing some work around filling those gaps, a little bit more networking, and it'll be face to face. So it's always a nice time when we meet face to face. So thank you very much, everybody. Thank you for being so engaged and engaging. And I'm sorry I didn't have my sparkle cat ears on. I feel like I've got something missing. So thank you. Have a lovely rest of your day and enjoy your 10 minutes gifted. See you later. Bye.
See you.
Bye. Bye.
Thank you.
Hi everyone, Danielle Thorpe from Pendlebury Council in the Policy and Programme team with Jill Dixon, who isn't with us today. She's got a day off.
Okay, thanks Danielle. Vic, I think you know who Vic is, don't you, Sonia?
No,
just in case others don't. Vic, do you want to introduce yourself?
Yeah, I'm Vic, Victoria McCoy. I'm Healthy Lifestyles Lead for Pendle Leisure Trust.
Thanks, Vic. Kim?
Complex Case Manager for Pendle Integrated Neighbourhood Team.
Thank you. Pam?
Social prescriber for Pendle East PCN.
It's like I'm talking to my mum on WhatsApp. I can only see that part of your face, Pam.
I was hang on. How's that?
Thank you. I can see your beautiful face now. Thank you, Pam.
You're welcome.
Fiona, do you want to just introduce yourself?
Hi, yeah, I'm Fiona. I work at the Up and Active team for Pendle Leisure Trust, and Vic's my manager.
Thank you. Daniel?
Team P9.
I'm sorry, we didn't quite catch that.
I'm team leader for older adults, team P9.
All right, thank you very much. Rashta?
Hi, Sonia. I work in the ICB. I'm part of the communications and engagement team.
Fab, thank you. And I'm not sure whether that's Becky or not. Becky, is that you?
Yeah, it is me.
Yeah.
Yeah.
Yeah, okay.
So I'm Becky. I work Burnley, Pendle, Rosendale, CVS for adult social care.
Thank you very much, Becca. Okay, without further ado, Sanya, do you want to introduce yourself, and then it's over to you?
Yeah, so I'm Sanya. I am the Community Engagement Coordinator for Women Welfare Foundation, but I'm also the Physical Activities Network Coordinator for Together an Active Future. So part of my role, me and Madge have been developing a toolkit showcasing the health and wellbeing community